Now, patients continue to bear the brunt of unjustified legal action against healthcare professionals. That's according to Ethiqal's clinical risk management specialist, Dr Hlombe Makuluma. He says patient care and doctor well-being are being undermined by the high number of ill-considered and unfounded cases brought against medical practitioners in South Africa. Now, last year, Health Minister Joe Pashla revealed that the doctor-to-patient ratio was only at 0.31 doctors per 1,000 patients. Makuluma joins us now for more from Pretoria. Doc, thank you so much for your time this evening. This is such a complex matter because it's just over the last few months, for instance, my colleague in the Eastern Cape reporting on high numbers of medical malpractice cases being lodged and telling stories that really tugged at the heartstrings of people who were really hard done by and hadn't received the healthcare services that they so rightly deserve. And you've decided to put up your hand to say, but there is also another side to this, and that there are a large number of ill-considered cases being brought against our doctors. Explain to me why your organization decided to look at the numbers and to talk about it from that point of view.
Thank you very much, Marcel, and good evening to the viewers. I really think that the first thing really that we need to say is thank you to our doctors. I mean, they wake up in the morning, if they slept at all, to look after the patients. And it is an important aspect in our economy to have doctors that will be working in very difficult conditions. So we really want to say thank you very much to our doctors. We appreciate them and the work they do. The question really is all about, we call it ill-considered allegations against the doctors. And I want to take you back to the normal thing that we know as doctors. I'm a doctor myself. Firstly, the first rule is do no harm. So every doctor that wakes up, there's that mentality that we're not going to harm our patients. Second thing is a doctor-patient relationship. When a patient comes to see you as a doctor, they've got a trust relationship. And therefore, if there's any problem in the process of this relationship, it's always important for the patient to come back, talk to the doctor first. That is basically the message that we are sending, because from where we sit, we can see that immediately that doctor has a litigation or a reporting for HPCSA without the patient having had time to discuss with the doctor. It causes a lot of problems for the doctor. And also on the side of the patient, it also has a problem with the patient because the patients don't really get, the answers they were looking for if they go into litigation or reporting before talking to the doctor. That's the message, really, in a nutshell.
Now, Doctor, taking all of that on board, will you admit, however, that you do also understand that because you're dealing with healthcare workers that are carrying a very heavy burden, especially at our government institutions, we know that the patient-to-doctor ratio is not where it should be, that the result of that is that mistakes do happen and that the resources, both human and otherwise, are not there to provide the kind of healthcare that many of our citizens, that all of our citizens deserves. And that is where some of the situations sneak in, where patients are not being looked after as they should.
I think it is an important point that you are raising. And it's a point that really, let's take it down to the doctor and the patient. That point really, it's a point that is beyond the doctor and the patient. It's the system at large. But we always emphasize that the first relationship is the doctor and the patient, especially in the private sector. It's the doctor and the patient. And therefore, within this broader system, we should understand that the doctor is doing the best that doctor can within the limited or the constraints that that doctor has. And at the same time, the patient trusts that the doctor is going to do the best the doctor has. And also medicine, in its nature, there are complications. Not every error not every complication, not every risk that the patient may encounter is due to negligence. And therefore, it becomes extremely important for the patient, whenever you're not happy, talk to the doctor. I understand that within the public health system, the relationship is broader than just one doctor and one patient. But in the private system, where we are really saying, talk to your own doctor before you take action. The other point that we are emphasizing here is that once you get into the litigation process, we all know that with law, they will say, don't talk to that person. When the patient actually is looking for answers, or maybe when we talk about a patient, we should also talk about the family, the partners, and other people that may want answers. What happened to my family member? What happened to that person? It's a bit complex and difficult in the public sector side because you don't have a one-on-one relationship with the doctor, but we'd like really from where we stand, we really want to talk more about the private side, which is the private sector doctors. That is where we really put out, our hand. We talk to the doctors. We inform doctors again about the knowledge gap, because what happens is that when a doctor gets litigation or litigated, it devastates that doctor. Some of them, they just stop practice. Some of them, they go through depression. Some of them, they change the scope of practice. In this very small, the ratio between the doctor and the patients, immediately there are ill-considered allegations against the doctors. The patients do suffer. We pledge and we urge patients. The doctor you went to, you trusted that doctor. You said, this is the doctor that I want him or her to help. If there is a problem, first talk to the doctor, exhaust all other means before you go into the litigation. That's basically the message that we want. And we appreciate our doctors for the work they do, understand that they're actually there to help patients.
Dr. Makuluma, I've heard anecdotally in the private sector that the high price that doctors in the private sector have to pay for insurance as a result of all of what we're speaking about now is also leading many of them to either consider leaving the country or leaving the practice altogether. How much truth is there to that?
There's enough truth to that. I mean, we deal with doctors every day. I mean, personally, in the organization I'm with Ethiqal, we deal with doctors, and there are doctors that would say, I have to work, 10 days in a month just to pay the insurance.
Sure.
And the next thing, after spending all my hours working with patients, trying to help patients, and there's just one allegation. It's even worse now. There's also a trend around criminalization. They get criminalized. And that devastates the doctor. They go on to, the whole thing about, leaving the country, that's another aspect. But the basic thing here is that they just say, look, I'm just going to go into farming. I'm just going to go into a different business because this doesn't make sense. But then we must understand. I mean, I read an article that says, who's going to deliver our babies?
Where
because
to from?
Doctors, they ran away from that.
My apologies for interrupting you, but as we bring this conversation to an end, you, in your statement, you make a point of mentioning that your statistics one reveal that of the complaints brought against healthcare professionals in South Africa, just 9% were referred by the Health Professions Council of South Africa to an inquiry before Profession Conduct Committee. Why is that percentage quite telling coming out of the HPCSA compared to the large number of malpractice cases that we're seeing coming outside of the realm of the HPCSA?
Actually, there are a lot of complaints that go into the HPCSA. But the process within the HPCSA is the doctor will need to respond, give an explanation. It could be mediated between the doctor and the patient. Other matters would be fine, we accept that there's nothing that the doctor is actually happened. That percentage is those ones that have gone through the full process. And I mean, and anyone who's been with the HPCSA, it's like a court system, where if it goes on to inquiry, you've got this side and that side, just like a trial that we see on TV. So then it's only 9%. So the message there is that if you go to the HPCSA, the process might take long, or your matter could be resolved before it gets to the almost similar court system that is managed by the HPCSA. Therefore, the message says, maybe you need to talk to the doctor, resolve it first, and see if you are satisfied with that. If you are not satisfied, and I agree that sometimes the patients may not be satisfied, then you take into the system. And there are matters where it will take years before it gets resolved. Either patients, get tired, or they don't have the means to attend to all the system or the processes that are involved. It's tiring, it's costly for the patient. However, let's go back. Doctor-patient relationship, a trust relationship. Let's go back and talk to the doctor first. If you're not happy with the doctor, then you can take it further, knowing that it's a long, expensive process.
Okay, we're going to leave it there. Thank you so much for your insight this evening. Dr. Hlombe Makuluma, the Clinical Risk Management Specialist at the organization known as Ethiqal. We thank him for his time.